Good evening, everyone, and welcome to our another Create Centre webinar. I believe this is our 17th in our long and continuing series. My name is Thomas DeAngelis. I'm the Create Centre Administrator, and it's my great pleasure to welcome you all tonight, and in particular, welcome those of our colleagues that are joining from regional Australia. It's very lovely to have you here and to connect with you. Before we begin, I'd just like to acknowledge that I'm coming to you from the Gadigal, the lands of the Gadigal people of the Eora Nation, and I'd like to pay my respects to their elders, past and present, and any Aboriginal and Torres Strait Islander people here that are joining us tonight. And if you would like to put in the chat box where you're joining us from, I'm sure there's a wide range of people coming from very, very different countries around Australia, so which is wonderful. Without much further ado, I'm going to hand over to Professor Emerita Robin Ewing, Co-Director of the Create Centre, and she'll take it from there.
Thank you, Thomas. Good evening, everyone, and thank you so much for joining us tonight. And I just want to encourage you to learn more about the Create Centre, creativity in research, engaging the arts, transforming education, health, and wellbeing. And we're going to hear particularly tonight about the arts and health and wellbeing in aged care. Welcome to Christine Mcmillan and Kate Smith, who are, when you read their bios, and I'm not going to tell you everything that they've done because it'll take too long, both have extensive careers in the arts and in health and wellbeing. The title tonight is called Virtual Art Snacks, Creative Arts and Wellbeing in Rural Aged Care. Such an intriguing title and something that I'm really looking forward to hearing more about. Just really briefly, Kate's career particularly traverses live and screen performance, academia and writing, and she is based in Bathurst and is the recipient of Create New South Wales Creative Fellowship for 2019 to 2021, researching live performance and podcasting. Christine is Arts and Health Coordinator, and her focus is to provide the opportunity to engage in the arts for residents, for staff and carers in health and aged care settings. Christine is a visual artist, and she was a director of Cementa for 5 years and has a background in visual arts teaching. She delights in presenting visual arts and workshops and organising music and performance. So I don't want to take up any more time. It's over to you. If anyone has any questions, they might like to put their questions in the chat box and we'll come back to them later on.
Okay, thank you very much, Robin, and thank you, Thomas. Today, I'm going to start off and then we'll move to Kate and then we'll alternate. So what we thought would be best is give you an idea of Arts OutWest's role in arts and health, because everything that we're doing in the Virtual Art Snacks program all hinges on the really solid base that we've developed over 12 years of working in arts and health. I'd like to acknowledge the traditional custodians of the land on which we work, which is the Wiradjuri people, and pay my respects to elders both past, present and emerging. Now, Arts OutWest is a regional arts development organisation for the central west of New South Wales. And we began working in arts and health when the Bathurst Hospital was redeveloped in 2009. And at that time, I was employed to work for 1 year. And at the end of that time, Arts OutWest thought that the program was of such value that it was added to the focus areas of Arts OutWest. Our director, Tracy Callanan, worked for Creative Partnerships in the UK, and she had seen the growth and the development of the UK arts and health work. So in retaining that position at Arts OutWest, we retained the knowledge and the partnerships that were developed during the development of Bathurst Hospital. And so with that knowledge, we also worked on many other hospitals. Another hospital we worked on was, we were on the advisory group for Orange Hospital, and Arts OutWest won the tender for the art program at the Lachlan Health Service, which is based in Forbes and Parks. So with that program, we did extensive consultation with the local community and ended up, that led to employing local artists, running workshops to create work for the health services, curating works for the health service, doing an artist residency that ended up with an installation of a major public work and exhibiting the local council collections and documenting the heritage collections of each site. One of the really significant parts of that project was the Aboriginal artwork and signage project, which was taken up by Western New South Wales Local Health District. And at the moment, we're working with Lake Cargelligo Multipurpose Service on a similar project. And we've also been asked to work with Mudgee Hospital to develop an arts and health program. We received funding from the New South Wales Health and Art Framework Grant to run training for a Musicians in Hospitals program, where we ran a 2-day training program, which included a video link up with UK-based musicians in hospital experts, Opus, and with an Australian music therapist, Kerry Davies. The training covered techniques for engaging people by the bedside, ethics, suitable repertoire, and working with health professionals. And the trainees also undertook practical experience in the hospitals. Now, underpinning our work in Art Snacks, we started working in multi-purpose services when Oberon Arts Council approached Arts OutWest to develop a program for the MPS. And this program aimed to increase social contact, providing a sense of achievement and reduction in loneliness and building self-esteem. And one of the residents of the art group at Oberon said, reaching out to a world that we were once part of. Please give me that feeling again so that I can touch the world that I once knew. And that was the way that she felt about the program. So Oberon Arts Council and their president, Fran Charge, who's also chair of Arts OutWest, worked on this program. And they won the Central West Volunteer Team of the Year Award for their work at Oberon MPS. And so Oberon MPS and the work that we did there and the groups that we connected with all form a model for the way that we work on Virtual Arts Snacks program. And so through the years, the Virtual Arts Snacks program has been informed by that work. We found that one of the key things in developing and sustaining programs is the relationships that are established. And those can be with hospital boards, arts councils, hospital auxiliaries, and funding groups, local councils and health services. So through this 12 years, we now have a MOU with Western New South Wales Local Health District and have developed a service level agreement, putting into place governance around arts and health programs and the employment of artists in hospitals. And this was with the support of Bridget Uren from Health Infrastructure. And we now have quarterly district meetings with Richard Cheney, the Director of Allied Health and Innovation, and health staff and community members. And all of this work has been really supported by the arts and health community. So Margaret Ma's arts and health conferences were really fundamental. Adrian Bogue's National Gallery of Australia Art and Dementia Regional Outreach Program, and the Institute of Creative Health, which was central to the formation of the Arts and Health Network, New South Wales and ACT, was also very important. So all these partnerships and links and relationships have created an environment in which our cross-sector collaborations have been able to thrive. Now, Arts OutWest is the regional arts development organisation, and in working on virtual arts next, we're also working with Arana Arts and Outback Arts, because they form the footprint which is covered by Western New South Wales Local Health District. And so in this map, the hospitals are the cross, the MPSs are the triangles. And so we aim to work with 25 MPSs in the Western New South Wales Local Health District. Our partners for the Virtual Arts Next program are CSU School of Biomedical Sciences and the University of Sydney School for Rural Health. The funding was from a Renew grant from the Australian government through the Regional Arts Fund. And this map is an image of the Western New South Wales Local Health District. The next map has the triangles. The triangles that are pink are the 6 multi-purpose services of Barradine, Blaney, Dunedoo, Nyngan, Oberon, Warren, that are in round 1 and 2 of the project, which is in 2021. We find that doing the virtual delivery, the program was designed so it could be face-to-face, but it is also a virtual program, because we wanted to be able to be really flexible to respond to what was happening with COVID. But also we found that virtual delivery is a way that we can actually get to all of these centres, because if we had to drive there and have artists located in all of those places, it would be prohibitive cost-wise. Now, so what's Virtual Arts Next? So Virtual Arts Next is a program for aged care residents in multi-purpose services, and it's been run across the Western New South Wales Local Health District. And we hope that the program that we develop will be able to be used in other residential care facilities. The program runs for 3 years. We have funding for 3 years, up to 2023. In round 1 and 2, we're doing 7 sessions of 3 art forms. And the art forms that we've chosen for the first series is Performance and Movement, presented by Kath McNamara, Visual Arts, presented by Rosalie Burns, and Music by Rob Shannon. Now, we wanted to get a really high quality, innovative and interactive program happening. And so we've supported our artists through a series of professional development. And we try and respond to their feedback that they give every week, so that we can really respond to what they're letting us know about how things are going. The artists are working with groups. They might be working with 4 or 5 different groups at the one time. And so they're working out ways of really being able to interact with the individuals rather than, say, looking at a prepared video. So the artists have been working together, and we'll talk more about that later. The next one. Okay. Now, the multi-purpose services. The multi-purpose services are unique healthcare facilities that provide a combination of services, including residential aged care with inpatient care, respite and palliative care, emergency, allied health and primary health. And they're located in small regional and rural towns. And historically, they've all been hospitals. So they have the infrastructure of a hospital. You walk into them and they look like a hospital, yet they are homes to a large group of people. What we looked at was the research that was led by Professor Jenny Priest. So in 2016, the Agency for Clinical Innovation conducted research into the quality of life care in multi-purpose services. The research was very extensive and it was Australia-wide, and it was undertaken over 2 years. And on this slide, you can see the 8 principles designed to improve the quality of life and well-being of the residents. I'll let you just have a read of that for yourselves. We chose 2 of those key principles, the home-like environment and meaningful recreation and leisure activities, to be a focus. Now, we also looked at other areas. So what in the arts world intersected with these? So, and we also looked at the Australian Commission on Safety and Quality in Healthcare and the National Safety and Quality Health Service Standards. We looked at the Arts OutWest KPIs and the Regional Arts Development Organisation Network KPIs, which were in development at the time. And the bits that intersect and cross over were we need to train arts and health workers to understand the value of meaningful experiences for consumers by active participation in artistic activities. We need to partner with the MPS network, health, community and arts organisations to support promotion and delivery. We need to be flexible and present an innovative program designed to allow virtual and face-to-face, multi-site training and delivery across remote and rural locations. We need to build a community of practice in arts in health in MPS settings across New South Wales for research and evaluation, and develop community and social connections in MPS settings via artistic workshops to foster emotional well-being and quality of life. Now, the image behind here is symbolic of the intersecting of all the elements that go together to provide a quality of life in an MPS. And the story behind the images is that as Kate and I worked on refining the presentation over many, many phone calls, I began making, illustrating my notes on lined paper, so drawings all over the place. And then I'd photograph them and I'd text them to Kate. Just said, you know, we could use these images as part of the presentation. And so I got a little bit more complex and had paints and paper and paintbrushes. And as we worked, I made marks on the paper that illustrated either the feelings or the idea that we were discussing. And so I've added these to the background and providing an alternative and an additional way of communicating ideas. And this reminded me very much of Rupert the Bear series, where there's a cartoon series with a number of different ways to enter into the story.
And so in that sense, we're applying a creative framework to all of the different ways in which the program is coming into being. So thank you, Christine, for all that background. We were inspired to go a little bit more deeper into the background of the relationships and the development of the programs, you know, prior to this, after watching your presentation, Robin, around the schools drama program, Drama in Schools program. And I really appreciated that background. It really helped contextualise, you know, and I said to Christine, look, I think we actually need more information here, because initially we were launching straight in around where this has actually come from, because as your program illustrated as well, your presentation, this is a slow moving, new, small program that we hope to grow, which is totally contingent on relationships. And the way in which that we're approaching those relationships is very creative. Through the research itself, the design, delivery and evaluation is all based on collaboration, drawing on the spirit of what you call co-mentoring. So Robin describes her co-mentoring relationship with the teaching artists in the Schools in Drama, or Drama in Schools program, and we call it co-creating. There's a lot of synergies there around the way in which we're working together to communicate ideas in the planning and design space, and also in the research and evaluation space. Dr. John Ray is our lead researcher, and we have the lovely Associate Professor Catherine Hawke here from the University of Sydney School of Rural Health. Thank you for joining us, Catherine, who's informing our, helped us with our ethics application. So we're actually working across music, performance, movement, painting, mark making and writing. So we're using the professional practice of the artists delivering the art activities, but actually the whole design of the program is drawing on our own expertise. And we're doing that deliberately to see if we can sit with complex and reflexive modes of being and doing to start to distill new knowledge. You know, drawing on my favourite social researcher, Denzen. So co-created by producers, artists and researchers is what we're doing. That's what we're all about. And really that's also what's exciting about it, is we're really looking to develop interdisciplinary practice as well as cross-sector relationships. And that, you know, has to be flexible and emergent. So one of the things that we're doing to kind of really just for fun, truly, is to kind of lightly theorise what we're doing. And we're applying Goffman's concept, dramatological concept of frame, to interpret the impact. And that idea was inspired through our professional development, which of course we were all doing on Zoom, or PEXIP, which is the health conference version of online meeting, to train and to figure out, you know, these poor artists were like, how the hell do I deliver an art program in performance and movement online to people who have all kinds of different abilities, from, you know, hearing loss to difficulty seeing to, you know, different kinds of abilities around communication, you know. So there's a lot to explore there around the actual delivery and design, but also around the technology itself and how do you manage the things that Christine mentioned. So when we met, there was the frame on the screen of, you know, like the patchwork, but we've got now like a patchwork quilt of the Zoom, and we were talking about the frames. And I thought, what an interesting thing to think about this idea of frame and how we organise communication and how we organise the meaning that we make of the way in which we're communicating around an organised activity, which is what Goffman's concept explores. So we're looking at the event itself, the time in which it occurs, and the space in particular, and what happens within the frame of those things. Each art form has rules that help with communication and participation, which is crucial in this forum, in any forum, but particularly with the diverse experience that I just listed. But also rules are really fun. And as we all know, as you know, if there's a lot of creative people here, rules generate expectations, they're playful. The boundaries are how we start to create meaningful experience and hopefully social connection. And so one of the reasons that we were looking at frame and are looking at frame is to see if we can start to change people's perception of what these MPSs are, because as Christine explained, MPSs are tiny little hospitals, but people are living there. So there's nothing about them really that feels like home, which is quite different to an aged care space. You know, we know the difference. Most of us have been and had deep experiences at some point with an aged care residence, and things like curtains or ovens or places to cook, or you know, nice smells, or, you know, comfortable chairs, or, you know, things like that really change the way people perceive and feel about the livability of their environment. So we're questioning here, can we change the frame and change people's perception? So yeah, that'll do. Banged on enough about that. So what we're proposing is that Art Snacks is reordering social space. It's actually, when we come together in the Art Snack space, we're actually creating a virtual studio. It's actually another space. And this is a theoretical concept which comes from, did I skip a slide? No. That comes from, you know, the French spatial theorists Lefebvre and Soja. So it's a really deep concept, and as soon as you get in there, it's like, it's so fantastic, but you've got to get out. But, you know, the depth of the notion of third space is something which is actually another space, which is not a social space. It's actually distinct from home or work, and it is specifically for leisure and social interactions. It's both a private and a public space. In this sense, it's online and located. And third space sits within the cultural sphere. It's a special place for focused activity. So a really clear example of a third space, the ideal third space, is the theatre. So you go there, you cross a threshold into a particular space, and we all agree that we're going to do this thing there, where we're going to have a meaningful experience that is both shared and private. So, and within that space, there is a deep potential for community, an invitation to find meaning and shared meaning. So within the frame of the third space of the virtual Arts Snack Studio, we're proposing that this is a meaningful universe sustained by the activity, which is starting to generate a space for being and doing for people in aged care, which is way beyond the dining room in the MPS, which is, you know, commandeered for an hour each week. And so we're interested in asking and posing the question, home is where the art is. The health space becomes an art space for this 1 hour a week. Even though it's virtual, it's still located and it's simultaneous. The virtual art studio generates expectations. It engages in meaningful activities, and it co-creates social connection, which hopefully creates a feeling of well-being. And our question is, does this temporary transformation of the MPS dining room into the virtual art studio make it more livable? Well, we don't actually know, the truth is. I'd love to say that it does, but we don't know yet. That might be really ambitious. But we would hope that at least for a couple of hours a week, that something is shifting within that environment, not just in the virtual studio, but in the actual locations themselves and the way in which people are perceiving their space.
So we stumbled upon the ripple effect, which impacted on well-being. So the idea of the ripple effect grew out of the professional development program that we're running with the artists, which includes sort of like feedback sessions and just getting together to talk about how it's going. And something that, so someone said that we passed a simple movement and it was like a ripple. And it was a lovely moment to see everyone cooperating together. So this was in Kath's session, the performance session. And so the idea of the art program having an effect beyond what was actually in the hour session, we started looking at that. So we had one of the activities officers respond and sort of say, you know, like, the male residents were getting up of their own accord. Like, they were up when I went to encourage them to get out of bed. And she sort of like, they were participating in the movement the movement program, which became, of course, Monday Movement Day. And so the actual program is having an effect outside the hours engagement. And those residents were also sharing their experiences with people that weren't coming along to the program. So in the individual that goes to the program is sharing that experience to the group. The program is on every day for 7 weeks, or is on 1 day a week for 7 weeks, and each art form has 1 day, so that's 3 sessions that they can attend per week. And so the residents are getting to know the artists, they're getting to know the medium, they're getting to know that it's presented on screen, which sort of, I think, has impacts also for telehealth. Because if you've never had a doctor's appointment online or never used Skype, and you have to talk to this doctor on Skype, it can be very confronting. So hopefully it will have an effect of supporting the residents in that area. So the groups also connect with each other. And so someone that's been in Oberon MPS for years, that's their environment, their world, their home. But they can see that, you know, they say, oh, Blaney's here today. And so they're connecting, Oberon's connecting to Blaney, to Ningen, they're all linking up. So those connections between the individual people. And we found out also that the artists, when we were discussing the program, like what Kate and I really like the idea of, is that the artists, in talking about what they were doing, would actually get together and form some sort of collaborative arrangement. We didn't know what that would be. We didn't say that we wanted them to do that, but they came up with that idea themselves. Well, how about we use a common theme? And, you know, we make work that the others respond to. And so the artists found the visual artist presented 4 images, and the musician and the performance person responded to those 4 images in over 2 weeks. So the musician created a waltz. And from that waltz, the artist took 2 pencils for a waltz around the page. And that idea of creating a waltz came out of the residents talking about movement and the way they used to move and the music that they used to listen to. So all of these ripples represent the possibility of unexpected consequences of the program.
And so in that sense, you know, the underpinning research methodology is participatory action research informed by creative research. And it's really beautiful because there's been a very natural willingness for the team involved in the creation of the project to evolve and share the sort of ideas so that we can actually genuinely plan, act, observe and reflect. So I think the idea of doing the research really authentically, not the before and after evaluation, but in that sense of actually finding out what that actually means as we go, because we are in the early stages, has been really edifying so far, because we really didn't expect that the professional development experience with the artists would end up being that co-creation. At first we thought it was really going to be a bit more operational, but it's actually become exceptionally valuable actually, and a huge part of the way in which the program is evolving into an exciting artistic space actually, as much as a project that is on the surface delivering art activities which you know, is quite commonplace. Yeah, that's probably enough to say. check my notes, bear with me a sec. Oh yeah, I actually did want to say something in regard to this, and it is that idea of the researcher as bricoleur, that, you know, that idea that you're drawing on multiple sources of aesthetic tools and deploying multiple strategies to surface knowledge and to plan and design and evaluate. And in that sense, creative methods we're finding, and we know, are a really efficient pathway to express complex shared experiences. And what we're hoping is that these communities of practice, by presenting here and reaching out to other organisations, that we're lowering cross-sector boundaries in design and delivery of programs like this. And so we're drawing on embodied practice because, of course, everything we're doing is embodied. And to reflect on that and to be reflexive about it is quite exciting, in that we're sort of going underneath the surface to look at what the embodied practices are bringing out in the residents in terms of their lived experience and their well-being. And the potential for how then these embodied practices could be used in an artwork or an art project to disseminate the information in some kind of creative, fun way. We don't know yet what that would be. So we're really looking to evoke emotional responses and provide these alternative forms of representation through the sharing of stories, through the movement, through the music. And in that sense, we're promoting a dialogue, not just between the artists and how they're designing, but also between the MPSs and the residents, as Christine just explained. And what's really interesting about this is it's a way of creative living for the residents in their own homes. It's action-based, and in particular, we're drawing out those localised narratives. We're drawing out those experiences that perhaps people don't think to talk about because you're seeing each other every day. So it's a facilitation to talk about rural and remote localised narratives, which is really specific to regional places. There's something about the ownership of space and localised narratives that is deeply linked to embodied and creative practice in regional communities.
So we have our regional communities with farmers and farmers' wives who had to do everything going. We had the man who worked the abattoirs and used to carry 200 kilos. I think, 200 kilos, that would be 10 of those 20-litre water containers. I have trouble lifting one up. And such strength. And so people are remembering through movement workshops, through visual arts workshops, they're reflecting and remembering with their bodies the body that they once had and the strength in their body that they once had. The gracefulness of the walls, along with the strength of the body that can lift those 200 kilos. And so many women remember washing by hand, which would have been, and ringing and rolling out for hours on end. Monday is washing day. So we have all of these memories that people start to share with each other. And with the artwork as being the instigator of being able to talk about those memories. And so it may also help bust that the story, like present a new story, remind a person that they have another story apart from the one that they keep repeating.
So we're suggesting that in this context, embodied practice can lead to a transformative experience for our residents, for the health staff who start to get a real kick out of the residents who they care for feeling well, and participating, and also for the artists getting the satisfaction to have their needs and concerns met through the professional development of their own practice and skills. From an anecdotal point of view, there's always resistance. So there's always the grumbler in the group who doesn't want to come along, you know, and is really resistant, and it's going to be awful, and I don't want to come out of my room today, or there's real reasons why people don't want to come out of their space. And so it's really beautiful to get the feedback where there's one particular lady who's our grumbler, and she's loving the program, and she has to be dragged there, and she's sharing who she is, and kind of revealing that she was a gymnast, and that she loved, being light, which is quite a contrast to how she resists the program in the mornings. Mornings are hard for her. So we're suggesting that embodied practice is an opportunity that again feeds into that ripple effect, which is, so for example, we have, our committee meetings, and the health service managers on those committees are now feeding back to the change that they're seeing in the residents. Who wouldn't normally participate in a program, particularly men, rural farmers who don't want to go and do art, for example, inverted commas. So, oh, sorry, I didn't mention something there. I'll just go back. Christine mentioned before that there's a language that's starting to develop, an ownership around the program. There's the Monday Movers, which has come from Kath's work. Rob Shannon is an absolute wag. He's our musician, and he's got the MPSs competing with one another. He's got them in teams. He's doing Mexican waves. And Ro, our visual artist, has renamed the program Art Snacks with an X, and refers to us all as Art Snackers, and her MPSs are all referring to it as Art Snackers as well. So that sense of belonging is starting to come through the language as well. It's running away, Christine. It's out of control. And so there's, of course, challenges, loads of challenges. And they're the kind of, we'll start with the challenges and finishes with the successes, I think. So competing priorities, there's the hierarchy of health, obviously, where in small MPSs, they have very, very short on resources. And so they're using the dining room, and they're using what's called a Wally, which is a TV unit. And if there's a health emergency, they need to take it and use it. iPads were rolled out during COVID last year, and initially we'd hoped that we would be able to use these iPads to deliver this program, and that's been completely impossible. There's no infrastructure to support the technology, so the iPads are sitting there being used in the most minimal possible way, and they won't increase the data load. So they've got the IT on the data is linked into the guest networks, and that means that there's not enough bandwidth. And we've been to all levels to start to, try and get that changed, or to speak to that. So it'll be really interesting to see in a couple of years' time whether we've actually had any success in actually getting those iPads activated. We haven't given up. We're very tenacious. But it's really interesting that to be able to have the support with someone like Catherine, who's, supported us through the ethics application, to be able to, deeply research this and then feedback to health within a framework within it. So that's really important. Translating value in that sense is the kind of other side of that coin. And of course, if there's a health emergency, of course, the resources that are existing need to go to where they're needed for a health emergency. But it's also about our sort of goal is to see this program for wellbeing as an essential service, not as an optional art activity. So, that's something that we would love to see down the track. Sorry, I'm just hiding something that's just popped up.
So one of the other issues that we face is the activities officers getting a change of roster, so they can't connect their groups. And so we're working with the manager of the MPSs and seeing if we can work out a support system that can keep the program going even if the activities officers aren't in the hospital or in the NPS.
Yeah, they're really short. They're under an enormous amount of pressure as well, and they work very, very hard. So it's a really delicate balance in terms of how we're supporting all of the different needs in the running of the program. So in that sense, it's, you know, is it sustainable? At the moment, it's an activity-based funding. So how do we grow the program to reach all those 25 MPSs in our area if we, you know, if it's activity-based funding, and we all know how precarious that can be. So this is projects funded for 3 years. So, you know, we would love for that to keep going. Christine, do you want to talk about the successes?
We've also, one of the really amazing things is the strong relationships that we've built, and the thing about building those strong relationships is you build champions for arts and health, and this is something that's happened at Oberon NPS, where Fran Charge is getting funding for programs at the MPSs from council, from other organisations that will fund arts programs that are locally based. And so getting those people on the ground and building those relationships is just so important to the success and the sustainability of the program.
All right, just my little thing. There we go. So finally, we just wanted to briefly discuss what regional creative projects are like. I spent most of my career in the city, and 10 years ago, or maybe 12 years ago now, I can't remember, I moved back to my hometown, which is Bathurst. And honestly, if someone had said to me, you're going to end up living out of town on a little farm working in Bathurst, I would have said, take me now. But, you know, I've never been happier. And I think that's partly because my artistic practice has expanded into cross-sector work. And it's a very natural place for artistic practice to live in regional places. And when I was in Sydney making theatre and in screen work, you know, that's your world, and you never do cross-sector collaboration. It doesn't occur to you. You don't need to. It's not really part of the deal unless you're a multidisciplinary artist. And so what was really exciting about moving into working with Christine, I was employed by Arts OutWest to do a couple of different programs with them in Arts in Health with Christine. I found that I really enjoyed the arts in health space. I found a lot of meaning there in terms of transferring skills into really valuable spaces. And there's something that requires a deep letting go of your own practice to work deeply with a visual artist, because a performance artist and a performer and a visual artist working together is quite different. We've called it when the soloist meets the collaborator. And so we've found that we've found a very playful and unstructured but structured way to work together. And it's very generative, and there's something really interesting about the time we take and the slow pace in which we allow things to emerge, which I think is part of, I mean, maybe it's corny, I don't know. It feels like it's part of a regional based experience. There's a lens on which we're doing, which is deeply linked to landscape and space. Christine, what do you?
Well, my regional arts practice, my arts practice developed in the region. So that's been my whole world of arts practice. And I was a visual artist, very much a solo show. And, but I started to think I'd really like to work out a way of being able to work with a performer. Yeah, how would you do that? And what I started working with Kate, that we have different languages. We use different terms. I have materials. I think Kate has props or something like that.
Yeah, that's right, props. We had a very funny conversation about that one day.
And so there's these differences, and so sometimes we have to explain very, very basic terms that we know how to do that. But the desire was to be able to work to see how we could blur the line between performance and visual arts, and to see the first project we did was at Gang Gang Gallery in Lithgow, where we did a response to the sculptures in visual arts, and then we explored it in performance, and then came back to visual arts. So we had this lovely sculpture of all of these figures on a flat board. They said, oh, looks like a skateboard. Well, we all learnt to skateboard that day. And so it was the combination of the talking about the artwork, the drawing, and then the performance led by Kate. Having Kate as a performer allowed us to step out of the bounds of visual arts. And so we've built like trust in working together, and trust with working with the health services and individuals in the community, and that's provided a really, really strong base to support our arts and health programs. Thank you.
Thank you both, Christine and Kate. That was a wonderful presentation.
Amazing.
A really fantastic program, it looks like. We've got a bit of time for questions, I think. So if anyone had any questions, maybe you could pop them in the chat room, and I'll pass them on. But I had a quick question. I'm curious to know about whether this program how strongly it will continue online once the pandemic abates. And I know you sort of touched on that in terms of the kind of regional sphere that you work in. It's difficult to go to the places in person and so on. So I'm curious to know, as the pandemic abates and we can move freely and there's no social distancing, what's sort of the future of this program, do you think?
I will, for the 3 years that this is going, we'll definitely still be working online. Yeah, but we'll be doing some face-to-face. The artists have said, let's do a road trip. We want to meet all of these people that we've been seeing on the screen. Yeah. So I think that it'll be a road trip to meet everyone, but then there'll still be virtual delivery.
Yeah. And one of the aims in the original proposal was to have artists in residence, down the track, which is, ideal. But yeah, so at this point, we really can't wait to meet them face to face.
Fran, would you like to make your comment to everyone?
Oh, I just want to thank Kate and Christine. I mean, they work really hard, and it's just amazing what's been achieved over the last few years. And having started off, before Arts OutWest even became involved in working in aged care, it's just so important that we put a really high value on this program and on what's happening. And the way that we're able to link these people, like they're sitting in Oberon and they're actually talking to people in Dunedoo or Warren or Nyngan. I mean, that's just amazing. Yeah. And I've noticed, as Christine said, that they're becoming much more confident. Initially the say Ro, who was doing the visual arts, she'd be asking questions and you'd have to kind of drag the answers out from them because they're a bit shy. But now they're just all, trying to hop in and answer, but they're very respectful of each other and they're respectful of all the other groups. So the way it happens, some of them are muted, and then they're unmuted when it's their turn to speak. And and quite often the presenters go off, and I go on every time mostly, and they go off, and then everyone's still chatting. Oh, we're still on. Oh, look at that. And you've got all that sort of unintended consequences, and then as each one goes off, they're just sort of saying goodbye, and you can see there's a really sort of a rapport that's developed, and you know, they're going, oh, I'm not the only one, oh, look at her, she's got a walker just like me, and you know, and that's hard to quantify the value of that. And I know Kate's doing a marvelous job, like getting all this research done and everything, but there's just those things that I'm just noticing, and well done to everybody, and thank you for having me on tonight.
Well, there's some wonderful comments in the chat room. Daria, did you want to make your comment?
Yeah, sure, Robin. Thanks very much. Thank you, Kate and Christine, for the presentation. I'm so glad I've made it. I'm quite new to this space, but I happen to be project managing a project that just been recently funded at Flinders in South Australia. And so what we're looking at is creating opportunities for creative artists to apply their expertise in a different space. And so I was interested to know, from your experience, how do you see the wider applicability and engagement of creative artists in designing such programs, given the complexity of what's involved, right? Because you have the researchers and the understanding of arts therapy. So in terms of the skills and knowledges, how do you see that evolving, and a wider engagement potentially or not?
I suppose with Arts OutWest, we're in quite a good position because we have a lot of experience at working within the health service and working with the health service. So all of those, the language and the all of the ways that the health service work is sort of like known to us. Mm-hmm. And so, as Kate was saying the other day, you know, like, it's amazing, why were you having that many meetings? Now I understand. Just the way that things need to be set up with your steering committee meetings, so that you can have an artist on that you have a health service manager, you have representatives from individual services, so you have community representatives. So all of those structures get set up that can support your program. And your visual or your creative artists can be involved in that space, but it just depends on what they want to focus on. And what actually.
Yes, yeah, definitely. Yes. So overall, it really does require input from multiple stakeholders in designing a program like that, or a creative artist needs to be quite experienced in art therapy already.
No, we're not doing art therapy. So we sort of, like, the way that we're looking at it is art therapy is a clinical practice, and the output of that clinical practice is a medical. Yes, it sits in the medical field, whereas we sort of like do artwork that's more diversional, and like creating community and creating connection between people, and also introducing new ideas. You know, so it's a different field. What was the other part of the question?
No, I think you've touched on both. Sorry.
Can I we are sort of running out of time, but Professor Sextu from Sydney Dehaan Research Centre for Arts and Health in the UK. Would you like to make your comment about publications? Perhaps she's no longer with us.
From England, it's a can you hear me?
Yes.
Yes, we can.
Yes. There's a lot to discuss, and I completely get the point about the experience and the relationships of trust in working within the health service. It is so important. The role of artists in healthcare is something that interests me a lot, and I would really like to read any of your publications, or build bridges with yourselves. I think it's quite important to find the links between the art form and the culture in healthcare, because we come into healthcare as outsiders from a different culture. As you said, we speak different languages. However, what we all aim for is to support individuals and communities. So it's really, really important to find a way to work together, and I think you've achieved that. So any more systematic evaluation of your work, I would really be very interested to read. Thank you.
Thank you.
Thank you. Yeah, I think we'll have to have, part 2 and perhaps part 3 when we hear more about how this is going over time. And Camilla, there's just one last question.
Can you hear me?
Yes.
I don't even.
Loud and clear.
Oh, good. I don't know if you can see me. I can't see myself there. I'm in YAS and work across, different fields, but I didn't know if there was any opportunity to either visit an MPA, is it MPA? Or MPS, sorry.
Multi-purpose service.
I might have missed where the artists were Zooming from. Like, are they in an office or at home? I just wondered if there was any scope to kind of be there, to
observe.
Yeah. And I understand if there's not, but
I think what you would I think depending on the COVID situation and depending on the individual MPSs at the moment, that if apart from that, it could be arranged that you could come in and be a volunteer in a session, so that you're actually getting in and helping people. Because when you're doing, the activities officers do an amazing job, because when you're actually there face to face, it's a lot of work, and it's wonderful to have trained volunteers in the space that can assist, because a lot of people have a lot of movement issues and aren't very mobile.
So Christine, could I contact? I mean, I know you, but I'm just wondering.
Yes, hello.
Hello. I'm just wondering if I could make contact and see if I could work something out with you. I understand actually moving into someone's private space and where they live is pretty, sensitive issue. So I understand if people don't want that. But just to have a yak with you about what's possible, that'd be great. Thank you.
Yeah. I'll just put my email address in the comments.
Great, thank you.
People are presenting from home and from one of the people, Kath has bad internet at home, so she's just coming into Charles Sturt Uni, and so she's presenting from there at the moment.
Okay. Great, thank you.
Well, can I say I agree with Thomas. I think, and everyone really that we've heard tonight, this is just a wonderful, wonderful program, and congratulations on what you've achieved already. And I truly mean that it would mean it when I say it'd be great to hear more about what happens over time. I think the program is definitely demonstrating the transformative nature of the arts, and how these kind of programs should be essential services. It's wonderful to hear you talking about blurring the boundaries of the different disciplines and coming together in that kind of transdisciplinary space. So thank you so much. Thomas, did you want to add something?
But it's just been wonderful to witness the connections between everyone that's involved in this webinar, and I think that's one of the things Create really loves to do, is connect people and see the connections be made. So it's wonderful to see it. Yeah.
So thank you everyone for joining us tonight, and especially Christine and Kate. Thank you so much. And we hope if you haven't yet joined Create, that you'll consider doing that and join us on another occasion. Good night, everyone.